Nursing Care Plan for Mental Health. Comprehensive list of nursing diagnoses. Nursing diagnoses address cognitive, emotional, and behavioral challenges affecting patients' well-being. Unilateral neglect impairs awareness of one side of the body, while impaired environmental interpretation syndrome affects the ability to process surroundings. Acute confusion involves sudden disorientation, whereas chronic confusion leads to long-term cognitive decline. Impaired memory further disrupts daily functioning. Behavioral and emotional difficulties also play a role. Ineffective impulse control hinders emotional regulation, and impaired verbal communication affects interpersonal interactions. Hopelessness can lead to despair and loss of motivation, particularly in those with chronic illnesses. Social and identity-related concerns further impact well-being. The risk of compromised human dignity affects self-worth, while the risk of loneliness can lead to social isolation. Disturbed personal identity, often linked to trauma or mental illness, disrupts a person's sense of self. Recognizing these diagnoses allows healthcare professionals to provide targeted care, improving patients' overall quality of life. Nursing diagnosis. Disturbed personal identity. Outcomes. The patient suffering from a kind of mental health disorder and distributed personal identity starts to recognize his personality as a united whole. The patient quickly identifies himself or herself and has fewer difficulties when communicating with others. Plan. Mitigation of the negative impact of any mental health disorder is a complex process that demands specific and individualized approaches to provide a patient with the most important and efficient methods that will promote his or her recovery and general improvement. For this reason, a plan that considers the individualized needs of a patient, his or her current status, and diagnosis is needed. The chosen patient, a 47-year-old male, has schizophrenia. One of the nursing diagnoses that could be applied to him is disturbed personal identity. Moreover, impaired verbal communication could also be related to him. For this reason, the following nursing care plan and interventions could be suggested. The main goal of this set of actions is the general improvement of the patient's state and his reporting of a decrease in the number of problems related to self-esteem and personal identity. Healthcare professionals should speak clearly and directly to the patient in an understandable and professional manner for him to acquire the information and be able to process it. Explain the nature of the problem and the main troubles that might result from it and the necessity and outstanding importance of treatment by pointing out possible complications and complete loss of personal identity. Nurses can teach the patient how to use specialized techniques that might help him gain control over his feelings and emotions and realize himself as a certain individual. Provide the patient with an opportunity to perform various activities that might help him remain an active member of society, as it is important for his self-esteem. Devote time to one-on-one interaction with the patient to improve his self-esteem and inform the patient when he starts to lose his own personality. Speaking with the patient about his personal interests, hobbies, preferred activities, games, etc., he admits the unique peculiarities of his personality. Creating a communicational pattern that appeals to the patient's self-esteem and feeling of dignity results in gaining trust and establishing comfortable relations with the patient. Avoid any actions that might trigger the growths of the patient's dissatisfaction and suspiciousness. Teach the patient social skills to interact with people and relatives and provide encouragement and praise for all success attained by the patient. These actions and interventions have a certain scientific rationale that predetermines the expected outcomes and proves the necessity of the implementation of these measures. The fact is that the patient suffering from schizophrenia and characterized by a distributed personal identity has particular problems with socialization and realization of their place in a certain community or society. For this reason, all interventions should be aimed at assistance with communication and socialization skills. Moreover, patients suffering from this disease might fail to establish trustful relations with people who surround them and provide support. For this reason, it is crucial to create an environment that will promote the establishment of close relations between the patient and his nurse. It will have a tremendous positive impact on the recovery process and contribute to improved outcomes. However, the patient should be able to function without any significant assistance and realize his personality as a united whole. Evaluation. Evaluating the given plan and suggested interventions, it is possible to state several crucial points. First of all, the suggested course of action has a scientific rationale that comes from the research related to the issue. Schizophrenia could be considered a great problem of the modern age, and there are numerous attempts to mitigate its negative impact by providing appropriate care for patients who suffer from it. In this regard, the suggested plan aims to provide the patient with the most critical conditions, medications, and treatments that might result in better outcomes. Yet, if investigate the outlined goals and outcomes, it is possible to admit the fact that the focus on the restoration of the patient's self-esteem and assistance in the reconsideration of the attitude toward his personality is crucial for the whole recovery process, as it might guarantee the improvement of the quality of life. Furthermore, certain specific nursing interventions are suggested to mitigate the negative impact of schizophrenia and help a patient to continue his existence. These should also promote the establishment of trustful relations between a nurse and the patient and the further evolution of their cooperation. As one can notice, most interventions aim to explain the problems a person suffering from the disease might face and the ways to overcome these very problems. Besides, a nurse should also be ready to devote a certain amount of time to communication with the patient. These interventions are needed to establish relations between a nurse and the patient and promote further cooperation. Finally, interventions are introduced to improve the patient's understanding of his identity by emphasizing activities, hobbies, and games he likes. These unique parts of a person's character determine its formation and serve as distinctive features between individuals. That is why their consideration is extremely important for a patient, as it will help him preserve his personality's main aspects. Altogether, the given plan could be considered efficient enough to guarantee the improvement of the patient's state and his further existence as a part of the local community or family. The plan's obvious strengths are its focus on the individualized needs of the patient and the creation of the primary interventions that should satisfy these very needs. Moreover, it also contributes to recognizing the prescribed treatment's importance and necessity. The patient will obviously accept the course and engage in the process. However, there are also several weaknesses of the suggested plan. First, it is not able to foresee all possible complications that might appear in the course of treatment. Additionally, there might also be some problems with the assessment of a patient's state and the provision of a relevant response to new alterations. The creation of an efficient plan is an integral aspect of the modern system of the delivery of nursing care, as it helps to improve the state of a patient and guarantee his speedy recovery. That is why a specialist should be ready to implement the interventions that might contribute to better outcomes.